Recording in progress.
Good afternoon, everybody, and welcome to the Dartmouth Adult Service Center. Most people know us by DASC. I'm Faith Scattalone. I'm the chair of the board of directors of DASC. And on behalf of our participants, our staff team here at DASC and the board of directors, we'd like to welcome everybody to this event today. We're delighted to be hosting you here at our building at Dorey Avenue. And we know that our Member of Parliament, Darren Fisher, whenever he can, will find an opportunity to highlight DASC and include us in announcements and events. So we very, very much appreciate that Mr. Fisher is here today. For those of you who don't know about DASC, I'll just take 30 seconds to tell you that we support the community here in Dartmouth of people with intellectual disabilities. We have about 200 people that we support throughout the year through community employment, social enterprises, recreation, leisure programs, and most of our participants are here at Dorey Avenue, about 75 to 80, with a couple of smaller sites out in community centers in Dartmouth. So this announcement today is very, very relevant and important to us. And once again, we really appreciate the opportunity to be hosting you here at Dorey Avenue. So with that, I'm going to bring Mr. Fisher up to the podium to take us through today's announcement.
Thank you so much, Faith, and thank you to you and the board and all the staff members here at DASC. If you could please send them a very warm thanks for all the work that they do. I'm a huge fan of DASC. I remember going to the old DASC down the street where the hallways were not even wide enough for a wheelchair. So when you get a chance to walk into this building, you get a real feeling of warmth when you walk through here, and hopefully ministers will get a chance to go over and sort of meet some of the folks here. It's just an absolutely wonderful, wonderful spot. Before we begin, I do want to acknowledge that we are in Mi'kma'ki, the unceded territory of the Mi'kmaq people. And I also want to take a quick second to shout out to my friend Hank, the executive director, who lost his dad after 25-year battle with blood cancer. And Hank and I were just chatting the other day about his dad and how he lived in under German occupation, and was there to witness Canadians helping to free those people over in Europe. So it was a bit of an emotional conversation with Hank on text the other night. So Hank, with you, bud. Certainly, I am pleased to once again be here at DASC with my two good friends, Jeanette Petitpas-Taylor and Mark Holland. I made a casual comment to them in the hallway. We have wonderful members of cabinet in Ottawa, but we have two members here in this room, and I'm thrilled to have you in Dartmouth. And by the way, if you see the sun out, the weekend has ended. It is a terrible trend that I'm seeing early on in the summer of 2024, that the sun comes up first thing Monday morning and the sun disappears midway through Friday afternoon, and that's extremely frustrating. But two members of council that, and I would use this phrase interchangeably with both of them, doing the right thing for the right reasons, the right way, is how I would describe both of these ministers. And again, we have some wonderful ministers, but it's interesting that the two of you would be here today in Dartmouth Cole Harbour, because that is exactly how I see the two of you. So thank you and welcome for being here. And those of you who are from Dartmouth, you know how great it is here in Dartmouth Cole Harbour. And for those of you who aren't, I'd be happy to chat and give you some business cards from real estate agents from the area. It is more and more difficult to find a place in Dartmouth because the secret is out, but we'll build you something if we have to. So I am, as I said, pleased to be here once again at DASC for a very important conversation on oral healthcare for Canadians. We've hit I believe, and Mark will speak to this and Jeanette will speak to this and probably correct some errors that I make, but we've passed, I believe, the 2 million Canadian mark. 2 million Canadians. And my mother is one of those 2 million who had been, I'd say, delaying dental care for a long time at the expense of other bills. And we're seeing that across the country. So this is a I will put an asterisk by this being a success story because, as Mark says very often, hard things are hard. These programs don't just start working perfectly. They have wrinkles. They require work. They require effort. And Mark, I have to tell you, you have toured this country back and forth, back and forth, back and forth. I've been with you a couple of times, and the work that you've put in is extraordinary because you believe in the program. You believe in providing oral health care to Canadians. And I couldn't ask for a better minister to spread that message across the country while also acknowledging that hard things are hard. National Pharmacare, another program that this minister is working so hard on, something that I've spoken about for 8 years. And I will say here in this room, I almost wrote it off thinking it just wasn't going to be possible. Those deals with each province and each territory across the country, those negotiations, hard things are hard, but you're doing the hard work and you're doing the heavy lifting. And I want to thank you, Minister Holland, for being here and your team for the work that you've done across the country, not just once, back and forth while you keep doing the hard work. Folks, please give a Dartmouth Cole Harbour welcome to my friend, Mark Holland, Minister of, my former whip, my former government house leader, but now our Minister of Health. Mark.
Thank you so much, Darren. It's an incredible pleasure to be here with you and with Jeanette as we continue this journey in making sure that 9 million folks who don't have access to dental care get the oral health care they need. Let me say to you, Faith, and to everybody, the volunteers and the staff, everybody who works here to do such incredible work, how much we appreciate you hosting us. You know, it's timely because we've just opened up applications, as you know, for folks who are 18 and under and for persons with disabilities. And so we're seeing a great uptake with people beginning to sign up for that program. And Faith, we had an opportunity to talk about how significant that can be for all Canadians. But, you know, when you think of folks, persons with disabilities who are focusing on making incredible contributions to their communities as they're doing here, just like all Canadians, they need less things to worry about. And not being able to afford oral health care or being in a situation where they don't get the care they need means that they can wind up being sick, they can wind up in incredible pain, and can pull them away from those contributions that they're making in such an extraordinary place as this. Darren's right. Darren, who's such a champion of oral health care and pharmacare and who I've worked so closely with on these issues, we now have 2.1 million seniors who've signed up. That's out of a potential pool of 3 million. And you could put that in perspective. Dans les provinces de Québec, par exemple, il y a 700,000 personnes qui peut accéder le programme, et le nombre de personnes qui sont inscrites dans le programme est exactement le même chiffre. Et c'est pas un accident. Quand les noms des dentistes et des autres professionnels est aussi haut que Québec, c'est plus que 60% des professionnels sont inscrits dans le programme. C'est le nombre de personnes qui sont eligibles pour les programmes et ça augmente aussi. And so I look at this and I say, okay, in just over 2 months, we're close to 50% of providers signed up. And in very practical terms, that's 250,000 people now who've received services in just 2 months. But as Darren said, for Jeanette, Darren, and our entire caucus, it's essential that every provider be signed up in the country. We have an incredible program. I know we haven't had a chance to say hi, but Dr. McCarr, I believe, is here in the room. There you are, yes. And Dr. McCarr and so many other providers are talking about what an exceptionally positive experience this is, to be able to see patients in their community who didn't have eligibility for care who are now getting care. But many providers said to us, and dental associations said, we want another way to participate. That the channel of participating because they've had bad experiences with different programs. They wanted to be able to participate on a claim-by-claim basis. So we listened. And today, I'm proud to say that the portal to apply on a claim-by-claim basis, so there's no formal participation required, is open. This means that for providers across the country, there's no longer a need to officially participate in the program. You can just try it out, submit a claim, and see what you think. And what we've been able to see is in communities where providers try the program, they're able to talk to other providers and say, actually, this is a fantastic experience. You know, Dr. Bakar has been out explaining to folks that this is something that's easy to use, has less administration than most private plans, and is an incredibly effective way to make sure everybody gets care. And so I'll just talk for a minute about what that means in a practical sense. You know, I was just in actually Halifax, I guess about a week ago at the Oral Health Summit. And I had an opportunity to talk with so many professionals who said things like, you know, and it was Fern and Ryland and a number of stories they told, but one that Ryland was telling me about somebody who was getting a new pair of dentures in his mouth, and how when those dentures went in, he came in with a haircut and his best suit and stepped up and put those dentures in his mouth and felt like $1 million. And that Ryland could see the weight of shame from not having teeth in his mouth be lifted. And that it looked like he had lost 15 years. And how excited he was to be out in the world, to interact professionally and personally. These are the stories. This is what this means in a very practical sense. Some of it's invisible, yes. You know, a lot of people now are going to get care, and that means they're not going to wind up in an emergency room. It means that they're not going to be struggling with terrible pain. They're going to be able to get the help that they need. That's practically what this is about. So when Darren says, you know, I'm everywhere in the country, I will not stop. My message is whatever it takes, we have to make sure that everybody gets this care, because oral health is health. And it is so absolutely essential that we pull that within the rubric of our healthcare system. We have one of the best healthcare systems in the world, but ignoring this means we're leaving all kinds of people resigned to a fate that isn't just fair from a perspective of social justice. It makes absolutely no sense from a perspective of prevention. So some people say, well, you know, how much is this going to cost? And we've said it's going to be $13 billion over the next 5 years. But how much is it going to prevent? How many hospital visits are going to be avoided? How many people are going to feel more confident going into that job interview because they've got a set of teeth in their mouth, or being able to walk in their community and feel like they can participate more, or maybe volunteer in a way that they couldn't before? Fundamentally, this is about the kind of country that we live in. And so it is why we want to work very closely with providers to show them this is, I think, a remarkable construct. It only works when they participate voluntarily and are having a positive experience, which means that this program is designed to work best when we work together. Today is a concrete illustration of that. I look forward to doing more as we push to see that nearly 50% become 60%, 70%, until in the near future, we're no longer asking the question of who's participating. We're talking about all the people who are getting care. And with that, it's my great privilege to introduce my friend and colleague, Jeanette Petitpas-Taylor.
Merci beaucoup, Mark. Thank you so much, Mark. And always great to be here in the beautiful riding of Dartmouth, Cole Harbour, with my friend and colleague, Darren. So thank you so much for hosting us today as well, Darren. And to Faith and Ashley, thank you so much for opening your doors to us. It sounds like you're doing some incredible work with the participants here. So thank you again for hosting us today. Mark, it's always wonderful to be here with you, especially to share this good news. I also want to take a moment, as I've indicated, to thank the Dartmouth Adult Service Centre for hosting us today. And I'm truly looking forward to hopefully being able to have a quick visit after the announcement is done. I am told that your mission to support the well-being and the belonging of becoming adults with intellectual disabilities is so important to our communities. And thank you for the tremendous work that you do day in and day out. It's always great as well to be home in Atlantic Canada to deliver some good news about the Canadian Dental Care Plan, and also called the CDCP. As of last week, parents or legal guardians of children under the age of 18 can now apply online for the CDCP on behalf of their children. I'm happy to say that adults with a valid disability tax credit certificate can also apply and are eligible. Cela signifie encore que presque 1,2 million de Canadiens et Canadiennes supplémentaires auront bientôt accès à des examens de santé bucco-dentaires et à des traitements dentaires plus abordables. This means that close to 1.2 million more Canadians will soon have access to more affordable oral health checkups and dental treatment. J'aimerais également rappeler que les personnes âgées de 65 ans et plus peuvent continuer à présenter une demande en ligne au RCSD et que tous les autres résidents canadiens admissibles âgés de 18 à 64 ans pourront aussi présenter une demande à partir de 2025. I would also like to remind everyone that seniors 65 years and older can continue to apply online for the CDCP, and that all remaining eligible Canadian residents between the ages of 18 and 64 will be able to apply in 2025. This historic public plan will eventually cover, as Mark indicated, 9 million Canadian residents and families income below $90,000 who don't have access to dental insurance. Let's just take a moment and think about that. That's roughly the combined population of Toronto, of Montreal, of Winnipeg, of Calgary, and Vancouver included. Now, let me tell you about the application process. And as Mark has indicated, we certainly want to make sure that it is simple and easy. We've made applying for the process as easy as possible. The online application form is convenient and easy to use. If you need assistance, you can absolutely get in touch. You can apply for the CDCP with the help of a trusted person or a delegate. Mais je tiens aussi à souligner notre approche numérique d'abord ne signifie pas que c'est uniquement numérique. I also want to emphasize that our digital-first approach does not mean digital only, because we certainly recognize that some seniors don't have access or perhaps don't use computers. So for those who need extra help to apply, Service Canada agents are available to facilitate access either in person or over the phone. And I personally can tell you that when my father-in-law received his notice in the mail, he was the first to be at the Service Canada office in Moncton and did his formal application. La santé bucco-dentaire est un élément important de la santé et du mieux-être général de la population canadienne. Il est prouvé que des visites régulières chez un fournisseur de soins bucco-dentaires réduisent le risque de caries dentaires, de maladies gencives et d'autres problèmes de santé graves tels que des maladies cardiovasculaires et des accidents vasculaires cérébraux. Oral health is a part of Canada's overall health and well-being. Regular visits to an oral health provider have proven to reduce the risk of tooth decay, gum disease, and other serious health problems such as cardiovascular diseases and strokes. So the announcement that Minister Holland has made today means that more people, many more people, will have access to the care and the support that they need. More seniors, more adults with disabilities, and more children. And I have to say, that's the kind of country that I'm proud to say that we live in. So once again, Mark, thank you so much for being us here today. And I think that I'm supposed to turn it back over to you, Darren. Merci.
Merci, Jeanette. Okay, I think what we're going to do now is have a Q&A session with members of the media. Josh Jagger, do you want to take the mic there and guide us through the process of any Q&As, questions and answers with our ministers?
Sure. Hi, folks. My name's Josh. I'll be moderating the Q&A session. For folks in the room, I'll just be moderating the in the room portion. So for outlets in the room, please raise your hand if you'd like to ask a question and state your name and the outlet that you're representing. And just a reminder, you get a question and a follow-up. Who would like to start?
I will, although I have a colleague in Ottawa who is going to ask via Zoom as well. But I'm Heidi Petrachik with Global News. Just wondering how confident you are that all patients who want to access the program now will be able to at their dentist, because in the past some had gone to their dentist who said they weren't participating. How much do you think that will solve that issue for people?
Well, this is, Darren said at the beginning, hard things are hard. It's true. This is the largest federal program ever launched. In 2 months, the fact that we're almost at 50% now, just under 50% of oral health providers participating, dentists, hygienists, and denturists, 250,000 Canadians served, more than 400,000 claims. This is remarkable progress in a very short period of time. But we always acknowledged that 9 million is a big number, and making sure that everybody gets the care that they need is going to take a lot of work. This is a very important, I would say, leap in that direction. I have spent a huge amount of time, as I know Darren and Jeanette have, talking to providers. I'm talking to them nearly every day. And, one of the things that I hear is, they've been burned by other programs. They didn't have positive experiences. So, making sure that they see and feel that this program is really listening to them and responding to their needs and being there for them and is a fair partnership is extremely important. I talked about Dr. McCarr. I mean, I think that if you talk to providers about their experience, it has been very positive, but a lot of them want to dip a toe in the water, right? They want to try this out, but they don't want to be fully committed. Since they want to make sure that it works for them, for their patients, for their practice. And that's why the claim by claim is so important. That's going to help things for sure. It's going to mean that it's a lot easier to get access. And we've seen regional discrepancies. There's certain parts of the country where we actually see denturists and dentists and hygienists putting ads, billboards out and out of home campaigns to attract people who are part of this program. And in another part of the country, we have shortages. So I'm going to speak just briefly to some of the other solutions we're working on outside of this. One is the loan forgiveness program. And, I've been to 4 out of the 10 dental faculties in this country. I'll be to every single one. And I get an opportunity to talk with the next generation of oral health professionals. And 2 of 1, they say, I want to come to rural communities. I want to come to smaller communities. But I got this debt, and that's a big deal for me. And, I need that help. So this program, I think, is going to make a really material difference. Because imagine it this way. Let's say you're a new student, you're coming out of one of those 3 streams I'm talking about, but let's talk about dentists for a second. You're a new dentist. Normally it takes about 14 years to do a book of business. Now you need 14 seconds, right? You've got patients who are lined up out the door for this program. But starting a practice is difficult, particularly in a community you don't know. Okay, that's where loan forgiveness comes in. And then we have, when we're talking with persons with disabilities, whether or not it's an intellectual disability or any other form of disability, these are folks where, we need to do additional training. There's a lot of dentists who haven't seen these folks ever. There's a lot of people who, we need to reach out to and connect and get to. So that's where the Oral Health Access Care Fund comes in. So it was always contemplated this would be iterative. I would say that this is a spectacularly positive start. That these numbers, if you were to ask me, represented, I think, our best and highest expectations and hopes for the first 2 months of the program. But we will be relentless, and it is our job. It is our job, frankly, to make sure that everybody gets care they need.
Follow-up question. How do you make sure a dental office is not going to be overloaded with patients and not be able to serve everyone in a timely fashion?
Well, in the first order, it's a good problem to have as a business to have more patients and more customers than you have space to be able to accommodate. I was in Scarborough, a dental practice that's operating at 200%. They're literally double where they were last year. So there's smoke coming off the wheels. And there's some that are ready to do that, but that's not everybody, and it shouldn't be. But a lot of people have folks within their existing client base, right? Where I say, look, even if you can't take on new people, you got a ton of folks who are in your existing client base who are very income insecure. Maybe they'd only been coming in to see you once every few years, right? And I'm talking to professionals who say, that person who's only coming in every once in a few years, they get major problems in their mouth, which ends up being more costly and puts their health at risk. So, I'm saying to folks, you got a claim by claim process now. Just even if you're going to do it for your existing patients, there's a lot of them that are vulnerable. And, every step forward, every new patient seen represents a huge, important success. So I think we got to be focusing on that consistent, steady progress forward. Seeing that provider number, I didn't say that provider number is now at 12,000. Every time I speak, that number goes up. Every time I speak, the number of patient goes up. So we just got to keep that pressure up.
Anybody else in the room?
Hi, Jonathan McGinnis, CTV News. We've heard some national numbers about the uptake of this program. Do you have a breakdown for what we're seeing here in Nova Scotia?
Yeah, it's Nova Scotia is improving. Nova Scotia is behind in terms of some other regions. And that is particularly more challenging in the rural and remote areas in Nova Scotia. And that's not surprising because they already were stressed. So part of the challenge that we're hearing from certain regions is that before this program even began, some rural and remote communities already had challenges meeting the patient needs for folks who already had insurance. So it was always contemplated that it would take a little bit longer to get to some areas. But I think we're working through the provider issues very well. We're seeing those numbers in Nova Scotia now moving up rapidly, and I think that's what you'll see because I look again in Quebec, which is the one that has been the highest. We're now over 60% of providers in Quebec, and once we get into a region, then you really get all of those providers out. So one of the reasons that I'm going in and having individual, and the next couple of days I'm doing all kinds of small roundtables with providers and really having those one-on-one conversations, because once they participate, then that really helps turn it. And so I'm very, very optimistic that over the next couple of months, we're going to go from 50 to 60 to 70 to 80%. And I think at a certain point in time, because there's a lot of people who are sitting on the sidelines saying, okay, it's great. I'll acknowledge it's working well. It doesn't seem to be a lot of administration. It's been really positive. But I want to wait a few months just to make sure there's nothing I'm missing, being careful coming in. But I think the more we sustain this positive momentum and the positive experience, then we'll get to a point of full participation.
We've heard providers, dentists talk about a lack of staff within their offices as a reason they're not able to pursue this program. How can this help in that area?
Well, today is a great example of it. Normally, as a health minister, I'm talking about doctors, I'm talking about nurses, I'm talking about personal support workers. Now I'm talking about dentists, denturists, dental assistants, hygienists, denturists. So now I'm part of the conversation, and Jeanette and Darren and I are fully committed to helping in this space. Before, oral health was off on its own. These issues existed before we came along, just they had no partner. And I think this is a real problem with oral health, is it was this bizarre bit of our health system that was floating out in a different orbit that public officials weren't spending any time and attention on. And I just use the example of the loan forgiveness program as an example of how we're bringing policy solutions to deal with this. Certainly, we're having conversations with Mark Miller as well around on a health workforce issue, around having foreign professionals who can help fill these roles, about how we get people to be able to fill those spaces, because we do have tremendous demand. And so we're partners in that solution. It was a problem before we arrived, but it's one that I think we can ameliorate through cooperation.
Anyone else from in the room? Seeing none, we will go online.
Thank you. If you're a journalist on the Zoom and wish to ask a question, please use the hand-raising function. We ask that you limit yourself to one question and one follow-up. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Our first question comes from David Aiken of Global News. David, please go ahead.
Thank you, Ministers, for taking our question. The question I have is, Minister Holland, your officials today, they gave us a technical briefing. It was very helpful. And one of the things that they mentioned was, and they stressed, this is not free dental care. And that, of course, is something that dentists had wished that had been communicated better by the government. So I wondered, could you right now affirm that it's not free dental care? And what will your government be doing to better communicate who's eligible, how to apply, what the limits are, how to get paid and all that? Because I think that was dentists' concern too, that their clients, their patients were showing up and really were unclear about some of the important details of the program.
Yeah, that's absolutely true, David. It's not a free program. So folks will get their package in the mail. For those that are under 70,000, they don't have a copay. So what we've done, dentists have a separate process to set their rates. We have a process that we've engaged in Health Canada to determine what we think is fair and what we think we can cover. And there's sometimes there's a difference between those. So they call that balance billing or equal billing. So folks should have a conversation with their provider, and they should expect that in many instances there will be some fees. So there can be a discrepancy. But, when I'm talking to people who are getting care, the vast preponderance of their cost is covered for the program. And that's indicative of most insurance programs that you would see out there. But I think it's in terms of what are we doing about it, the package that people receive clearly enumerates that. And then secondly, I'm talking to, in fact, I just had a talk with the head of the Canadian Dental Association to say, okay, we've got some material. How do we make sure that you can share that to your patients? I think anytime you start a brand new program, a lot of times you have folks who have never gotten care, have never interacted with a dental office. So there are a lot of questions, and I think that those are fair, and we want to help ease that burden of making it as simple to understand for patients as possible.
Thank you. That's great. Looking ahead to the possibility where a province, and we know Alberta might be one of these at this point, says, okay, Minister, we want to work with you. We want to supplement our provincial program or whatever it might be. Would you begin your negotiating position with the province saying, whatever we do, we don't want to mess up this new arrangement with providers and patients? In other words, it may be an issue between Alberta and Ottawa where the money goes, but we don't want to, if you even understand what I'm saying, once a patient gets used to using this program, once a provider gets used to billing Sun Life directly for this program, presumably you don't want to upset that for providers and patients.
Yeah, that's absolutely right, David. So, I think what you're seeing is a very positive experience, both for providers and for patients, and that has to be maintained. And patients need to know that there's not going to be a deterioration in their coverage. Let me state it very plainly. Danielle Smith can say whatever she wants. She can make whatever proclamation she wants, but we're not going to allow people who don't have coverage in Alberta or anywhere else in the country to lose their coverage. Now, if Alberta wants to take it over, I don't have a problem with that. I think that, for Darren, Jeanette, and our entire caucus, our mission here is to make sure that people are covered and taken care of. I don't think a senior who's walking into, Dr. McCarr's office cares who pays for the darn service. Like, they just want to get teeth in their mouth, or they want to get them cleaned so they don't get sick. This battle over jurisdiction, that's an inside baseball kind of conversation. What the patient cares about is the patient experience. What the provider cares about is the provider experience. And I'm here to guard against that. I'm here to say that we're in this program, I think, has been remarkably successful in both serving patients and providers. And that's the standard, and it's got to be met. And in terms of jurisdiction, the fact of the matter is Alberta can say, well, folks, this is our jurisdiction. Well, you didn't do it. There's hundreds of thousands of people who don't have coverage, right? So if it's your jurisdiction, well, then why didn't you provide people this coverage, right? We're stepping in and saying there's a tremendous need here. And I think with Alberta on other issues, because of our responsibility under the Canada Health Act, because of our responsibility with health transfers, we could find an agreement on working together. We could find an agreement on aging with dignity. We could work on primary care. We can find all kinds of ways to work together. I would say that's what people expect of us. They expected us to work through these problems and find solutions for people, not to find, lines to draw and battles to have and arguments to be made. So, I would encourage Alberta to approach the conversation in that spirit.
Thank you. Notre prochaine question vient d'Olivier Ferron-Boissé de LCN. Olivier, à vous la parole.
Oui, bonjour à vous tous. J'avais une question pour vous, M. Holland. Je me demandais à quand les gens et les provinces peuvent s'attendre à avoir votre modernisation de l'interprétation sur la loi canadienne de la santé et si vous prévoyez toujours y avoir là-dedans mettre fin aux frais liés aux soins de santé virtuels.
Oui, les conversations avec chaque province et territoire, ça continue. Et c'est maintenant, on a besoin de temps pour une nouvelle lettre d'interprétation. Et ça va arriver bientôt. Mais la conversation avec les provinces et territoires, ça continue bien. Et pour moi, il y a une ligne claire. C'est absolument essentiel de s'assurer dans notre système universel que le patient ne paie pas et de s'assurer que l'accès est disponible pour toute la population et de s'assurer aussi que l'industrie et l'entreprise ne mettent pas en place un système privé qui est plus coûteux et moins accessible pour la population en général.
Il y a le cabinet du ministre de la Santé, votre homologue du Québec, Christian Dubé, qui a réagi à cette intention-là, puis qui lui estime plutôt que ces programmes-là, notamment fournis par les employeurs, c'est complémentaire aux services publics. Il pense que ces changements-là auraient un impact négatif sur l'accès aux soins pour des centaines de milliers de Québécois. Puis vous accuse d'ajouter des contraintes. Est-ce que, selon vous, c'est avec la situation dans les hôpitaux, on sait que du manque de main-d'œuvre, que les temps d'attente sont longs. Est-ce que c'est le moment d'aller avec ces changements-là? Est-ce que c'est pas mal choisi un peu?
Oui, pour moi, au début, le principe est absolument important, de s'assurer que notre système reste public et universel. Et de s'assurer aussi que tous les services sont disponibles pour la population généralement. Et c'est clair dans des autres situations, particulièrement avec le ministre Dubé, juste pour cet exemple-là, qu'on peut travailler avec un bon esprit de coopération. Et je pense que notre bout sont les mêmes sur la question de s'assurer que oui, il y a une pénurie de main-d'œuvre maintenant, et ça, c'est un problème, et ça, c'est la raison pour laquelle on a une attente sur ces questions-là. Et aussi, on veut l'innovation dans l'espace pour les santé virtuelles et s'assurer qu'il y a des bons un bon équilibre entre les intérêts de protéger les santé publiques et dans l'autre côté, d'encourager un bon esprit d'innovation, de créer des nouveaux types de santé en distance ou virtuellement, parce que ça, c'est tellement important, particulièrement pour un pays comme le Canada.
Thank you. Our next question comes from Marina von Stackelberg of CBC News. Marina, over to you, please.
Hi there, Minister Holland. Thanks for taking our questions. Firstly, when we were talking in the technical briefing about providers that have signed up for the program, is there a benefit for oral healthcare providers to actually sign up now that they have this other option beyond maybe just being listed on the provider website?
Yeah, so I think there are a number of providers who prefer to be signed up so that when they get notice of any changes, there's a 30-day period where they'll be notified in advance. And the ability to be on a roster. I do hope that second issue of being on a roster of those who are participating does disappear, because our intention is to have every provider participate. We're trying to make it as the same experience as we can. Like, we're not trying to create a situation with those who are using the alternative pathway where they don't have access or they're treated anyway differently. But we do notice that some people prefer the idea of officially participating. They've been very comfortable with how that channel of participation has worked, and there's others who don't. So I'm trying to be relatively ambivalent in terms of which path providers use.
Just a few days ago, the Canadian Dental Association put out a statement talking about misconceptions about the program, saying that the federal government needs to, in their words, urgently improve public communication about it. They talk about how some dental offices, their staff are spending up to an hour explaining the program. There's patients that are showing up who are quite disappointed or maybe thinking they have coverage and don't. So what is your response to that concern? This has been a concern in the past, but the Dental Association is saying as recently as last week that there's still a lot of miscommunication, a lot of misconceptions.
Well, I think there are two different categories. So let's speak about them each in turn. For the nearly 50%, and it's just shy of 50% of oral health professionals who are participating, I'm frankly not hearing those issues. In fact, I was in, Josh, you were with me. I think it was actually here in Dartmouth, Cole Harbour, and we're speaking to a hygienist. Darren, I think maybe you were with us. And she was saying, like, I keep looking for the paperwork. Like, I keep being told there's lots of paperwork and confusion. I can't find it. And this is a very large basket of services. It's larger basket of services than most private plans. There's no limit on if it's no cap. In other words, if it's medically necessary, it's going to be covered. So people who are participating, maybe there's a quick conversation about is there balanced billing or equal billing. But other than that, it's no more complicated than any other plan out there. In fact, it's less complicated. Now, for people who aren't participating, for the other 50%, yeah, that's some work, right? Because you got to say, why aren't you participating? Why aren't you joining? And you're getting all kinds of people, saying, I need dental care. And, so there's a part of that I can't fix, right? People who have access to care and want to use a dentist are going to call the dentist and say, why aren't you participating? And they're going to have back and forth about why they're not participating. So there's some of that I can't control, right? But what I've said to all providers is that, look, we are people of logic and reason. If there's something that we can improve in your experience, we'll do it. But I really do encourage them to talk with the providers, the nearly half of providers who are participating, who've had a really positive experience and aren't experiencing these issues. And by the way, once you start participating, then those questions disappear because people are just getting care. And that's the point we want to get to.
Thank you. Our next question is from Laura Osman with the Canadian Press. Laura, over to you.
Hey, Minister, thanks for taking questions today. I just got off the phone with the president of the Canadian Dental Association, just as you were taking the mic there. And basically what he's saying is that this new claim-by-claim process is not different from the other process because the terms and conditions are the same. What is your response to his concern, saying this really doesn't fix the problem from where he's standing?
Well, it changes it a lot. I mean, first of all, in the first order, you're not participating in anything officially. You're just doing it on a one-off claim basis. So that eliminates a lot of their concerns around being bound to a program. It's why we did it. In terms of there being terms and conditions that exist, every service contract you enter into has terms and conditions. The terms and conditions that we have are standard claims and processing terms. We can't eliminate those. I mean, I don't know anybody, and you don't need to know much about contract law, but anytime you do business with somebody, it's a good idea to have some kind of contract. And if you don't, you're crazy, and so that's one we can't fix for them. I mean, there is no insurance anywhere that doesn't have a standard claims and processing agreement. So some of those are more visible than others. Some of them are more behind the scenes. We just happen to be really upfront about what those claims and processing agreements are. And let me get into what some of those things are. You can't commit fraud, that you're agreeing that the basket of services are what's agreed to. And most importantly, and I'm going to speak very directly to this because I'm frustrated on this, the patient doesn't pay out of their own pocket. And we have certain providers who are handing over Sun Life forms and saying, you go send this in and you go pay for it. No. Look, I even had a guy say to me who's a provider, let them get a credit card. Well, let me be very clear. If you're a senior on $26,000 a year, going and getting a credit card is not a valid option. We pay the claims in less than 48 hours. In most instances, they're in less than 12. So they're providing service and you're getting money in the next day. But if you're saying to a vulnerable person, and let's talk about, all the people we're talking about families, who are trying to get by, trying to make ends meet with their kids, being asked to front the money. And by the way, in that instance, we got to be able to figure out where they are, send them a check. It's much slower. And we're going to say they've got to hold the burden. So yeah, we have like any other agreement, there are terms and conditions. I can't make those go away. I would rightfully be pilloried if there were no terms and conditions. But we made those just the standard claims and processing agreements that exist anywhere else, Laura.
Thanks for the response, Minister. And so you're saying that these terms and conditions are exactly the same as for other Sun Life programs, essentially, when it comes to the ability to review claims after the fact and so on?
Yeah, the only issue, Laura, that I'm aware that the dental associations have brought up is there are some that are concerned with the audit process. So let me be very clear. I've been clear in those conversations. I'll be clear here. And providers can see it over the last 2 months. We have no interest in auditing anybody unless there's evidence of malfeasance. So if there's evidence of malfeasance, we have an obligation, obviously, to check that out. But we're not, you know, the fears of spot check auditing or like going into people's businesses, like that's not what we're looking for. And we've been very, very clear on that. So that's the only issue that I'm aware of that they take umbrage with. I guess I would push back, Laura, to you to say to them, show me what's different about this claims and processing agreement from any other claims and processing agreement. The only answer I've heard to that is there's concern around the auditing process, where we've said that it's only activated in the event that we have evidence of malfeasance, and hopefully we would have alignment on that.
Thank you. Notre prochaine question vient de Mylène Crête, La Presse. Mylène, à vous la parole.
Oui, bonjour, ministre Holland. J'aimerais savoir, il y a une pénurie de dentistes dans certaines régions du Québec. Quel est votre plan pour former plus de dentistes?
Oui, c'est une bonne question. Il y a une pénurie de dentistes dans les campagnes et des régions rurales. C'est absolument le cas. Il y avait un problème avant le commencement de le programme. Et pour nous, dans le budget 2024, il y a des fonds là pour des loan relief. Qu'est-ce que c'est ça? Annuler le prêt pour les étudiants quand les étudiants vont pratiquer dans les campagnes ou dans les régions rurales. Et pour moi, ça, c'est vraiment important. Et comme j'ai déjà dit en anglais, c'est quand je parle avec les étudiants, c'est clair qu'il y a beaucoup de personnes qui veulent déménager dans la campagne, mais premièrement, il y a une question avec les coûts pour l'éducation scolaire, et ça, c'est notre action dans le budget. Mais dans l'autre côté, les personnes peur que oui, c'est difficile de commencer une nouvelle entreprise, mais dans la campagne, il y a un besoin énorme. Et ça, c'est la raison pour laquelle je pense que c'est vraiment important de garder le programme. Parce que si les étudiants savent que le programme va continuer, c'est facile de planifier leur carrière dans la campagne. Mais quand M. Poilievre dit que le Parti conservateur va annuler le programme ou n'était pas clair sur le futur du programme, c'est difficile pour les étudiants de déménager dans la campagne et de commencer leur entreprise avec les situations comme ça.
I'm going to ask my follow-up in English. Other than the loan relief, is there any plan to actually train more dentists, like to work out with the, I guess, universities and in that instance in Quebec to train more dentists?
Yes, absolutely. So loan forgiveness is one. The second is the demand and making sure that that's there, because that will drive a lot of students. As I've said, I've been to 4 out of the 10 faculties of dentistry in this country, talking to them about how we can work more closely together and expand the number of folks who come in through those programs. We're also looking with Minister Miller on the immigration front. And I would say we have the Oral Health Access Fund. The Oral Health Access Fund was specifically designed to go after what are going to be more challenging areas. And we knew that right from the beginning, that rural and remote communities are going to be more of a challenge, and that Oral Health Access Fund is now taking applications for creative solutions of how we're going to deal with that. So think about Navjeet. I was just last week, I believe it was, in Windsor, and Navjeet has a mobile clinic, and she goes into rural and remote areas that otherwise don't have care, and goes visits them with a truck that's totally loaded to be able to see people in that truck and basically bring services to them. So there's a lot of solutions we can deploy like that. That's what the Oral Health Care Access Fund is. So we're trying to take this, from working with the dental schools to using the Oral Health Access Fund for creative solutions to get to difficult communities, to working with, different groups that are, because when we talk about the persons with disabilities community, there are really special needs for those communities as well, and training, helping to train dentists. So this is a big deal, right? I don't want to hold this out as a snap of the fingers to get to everybody, but we're coming at it from as many directions as we possibly can.
Thank you. Prochainement, on a JL Lapointe, je crois, de Radio-Canada, si vous pouvez confirmer votre nom et votre média. J'attends juste un moment. Okay, peut-être il y a des problèmes techniques. Okay. Next, we'll go to Suzanne Lapointe of Global News. Suzanne, over to you, please.
Hi, so I'm wondering if you are able to give me any New Brunswick specific information about this program, what the uptake has been like in New Brunswick.
Yeah, I don't have the breakdown of providers for New Brunswick. We'll follow up immediately after this with those numbers for you.
Okay, as a follow-up, we spoke about, possible training that would need to happen. New Brunswick has one of the worst rates of patient to dental hygienist ratio. There's a very big need for dental hygienists. Are there any plans to implement trainings or incentive for people to pick this career path to correct that problem?
Yeah, look, this is a phenomenal time to become a dental hygienist. There's enormous need. So working with the association that represents the hygienists, we've had really great conversations about how they can meet this moment. This is, it's a shorter path. In a couple of years, somebody can be trained as a hygienist and be deployed. One of the things I will say that does permeate all of this, and I've talked to students, whether or not they're denturist students or hygienist students or dental students, is that the cloud of uncertainty of where Mr. Polyev stands on this program creates a real problem. If you're a young person and you're seeing this incredible opportunity with all of these patients, whether or not it's in a rural community or you're talking in New Brunswick being a hygienist, and you're making that decision to start your career, you want to make sure the rug isn't pulled out from under you. We need to commit to this program. And I would say to you that that really fundamentally, people being able to have teeth in their mouth and being able to get their mouths clean to make sure they don't wind up getting sick should be not a political conversation. Like, let's get past that so that people can start planning their futures. The reality a year out from now is that it's going to be millions of people who will have gotten care. I don't think you can pull that away from anybody, but it shouldn't take that to get to political consensus. Political consensus is deserved now. I think this should be something that transcends politics.
Thank you.
Thank you. Next, we'll go to Tessie Zanchi with the Hill Times. Tessie, please go ahead.
Thank you. Minister Holland, you said you want to see full participation in the program. Earlier, in response to another question, you also said you were ambivalent about whether dental providers were on claim-by-claim or formal registration. I just want to clarify or make sure the claim-by-claim process is a permanent feature, correct?
Correct. Okay. That's correct, Tess.
And can you also just clarify, you made a reference to 12,000 providers. Are those the number of providers who have signed up thus far through the formal registration?
That's correct, because no one's been able to access the claim by claim. So we stand at 12,000 before today's action of claim by claim.
Great. Thank you very much.
Thank you. I think the silence might indicate conclusion to things. Is there anything else there online, folks?
Excuse, on a la dernière question de Julie Lapointe, Radio-Canada. On a essayé encore une fois. Julie, vous êtes là?
Oui, est-ce que ça fonctionne?
Oui.
Bon,
merci.
Okay. Julie Lapointe de Radio-Canada, je vous confirme mon identité. Ma question, c'était en quoi ça peut devenir ce dont vous parlez aujourd'hui, en quoi c'est avantageux pour un fournisseur de soins dentaires d'embarquer dans cette option-là du remboursement à la pièce, du remboursement au cas par cas? Parce que nécessairement, ça va vouloir dire d'autres paperasses à remplir. Est-ce qu'il y a un incitatif pour eux de dire, OK, oui, moi, j'embarque là-dedans, donc ça va être avantageux pour moi, pour un fournisseur?
Oui, l'incentive est que le logiciel est vraiment simple de l'utiliser. C'est le même logiciel qui existe pour n'importe quel autre type de programme de l'assurance. Et ça, c'est la raison pour laquelle je pense que quand la personne va essayer juste une fois, et la personne peut voir le processus et le logiciel est vraiment simple et le même logiciel est presque le même processus qui existe dans le système privé. Ça c'est un bon incentive d'augmenter le nombre de clients qui peuvent l'utiliser le programme. Parce que même si le dentiste n'avait pas l'espace pour les nouveaux clients, c'est le cas que il y a beaucoup de personnes avec le dentiste actuel qui, dans un état de vulnérable, avec les questions d'abordabilité, c'est vraiment une vraie question. Et si, avec les clients qui existent actuellement, c'est possible pour les personnes de l'utiliser ça. Et il y a beaucoup de pression pour ça. Et ça, c'est la raison pour laquelle il y a beaucoup de personnes chaque jour qui téléphonent le dentiste de dire quand est-ce que le programme va être disponible.
Mais en ce moment, il y a déjà plusieurs régions où on voit qu'il y a une pénurie de professionnels en soins dentaires, des clients qui sont inscrits sur des listes d'attente depuis longtemps. Est-ce que la responsabilité finit pas par revenir quand même sur les épaules des clients, encore de trouver un fournisseur de services qui va accepter de gérer la facturation avec Sun Life?
Dans le contexte actuel, oui, malheureusement. Mais ça va changer chaque jour. Chaque jour, il y a plus en plus des dentistes et des autres professions qui inscrivent dans le programme. Et au début du programme, on dit clairement que c'est un processus. C'est le plus grand programme dans l'histoire de notre pays. Et il y a 9 millions de personnes partout au pays qui ont besoin de service. Et ça prend le temps. Et ça, c'est les raisons pour lesquelles on prend toutes les actions autour de l'annonce aujourd'hui.
Merci. So this will conclude today's news conference. Any additional questions can be directed to Media Relations at Health Canada. La conférence de presse est maintenant terminée. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada. Merci et bonne journée. Thank you and have a nice day.
All right, folks, thanks very much for attending today. Faith, you, Ashley, and your team, thank you for hosting us here at DASC. Always wonderful to be back. Look forward to laughability next year. And again, sending my best to Hank, your executive director. Thanks, folks.